Hello friends. Dengue, Chikungunya, Zika are vector-borne diseases and they are spreading at a number in many major cities. People are getting affected at a large numbers. Most of the people are recovering by medications and supportive care, but few people are landing in severe cases which may result in shock syndrome where there is hypovolemia, that is low blood volume and low platelet count. But there is no need to get afraid because most of the cases are recovering by supportive care and medication. But also, many of my patients are complaining of post viral residual symptoms after the active phase of the disease. That is, many people are complaining some ongoing symptoms which they are experiencing after the active phase has been passed. So, what are these symptoms? Many patient complaints of pain in the joints or swelling in the joints. Some people complain of stiffness of the joint. There can be weakness, there can be fatigue. Some people are also complaining of less appetite, and some people are complaining that they are getting confused while handling multiple things. These all are post residual symptoms which a patient is experiencing after the viral active phase. So, what all things can be done for faster recovery and reduction of these post residual symptoms? Let's see one by one. Many of the things that can be done, can be implemented, is by adding few things in your diet, especially during the recovery phase, and following certain lifestyle changes into your routine so as to reduce the severity of the symptoms. So, when it comes to diet, what all things can be done or included in your diet so that you will have good immunity? Then there will be strength in the joints, the fatigue and weakness that one is experiencing will come low, and also the recovery will be fastened. Number one is fluids. Fluids are extremely important for normal functioning of any individual, or I would say our body is composed of almost 60 to 65% of water. And when there is any infection in the body during the active phase, there is loss of electrolytes or there is fluid loss which creates imbalance in the electrolytes, and this needs to get restored for the recovery of the body, because due to the loss of electrolytes, many of the functions are affected in the body which has to happen normally. So, fluid should be taken in adequate amount, especially in the active phase as well as when the person is in the recovery phase. So, you should drink lot of water. You can drink coconut water, you can have ORS sachets dissolved in water, or even you can have fresh juices which can be sipped maybe in a day's time. One glass full will be very effective for restoring that fluid balance and electrolyte balance. In dengue, the platelet count goes down. So, if the platelet count is going below the accepted value, and maybe due to medications and supportive care, and after the viral active phase, the count starts rising slowly. But so as to fasten this process, even during the active phase as well as the recovery phase, there are few food items that you can include in the diet, like papaya, then papaya leaves juice, then beetroot, then spinach and green tea. So, these are the foods that which you can include to increase the platelet count. And one more to include in this is green aramanthus. Green aramanthus is a leafy vegetable which you can include in your diet. Either you can make a sabzi or you can add it into curries or any form you like, but try to keep it in the diet. It will help increase the platelet count. Number 4 are the food items which are rich in antioxidant properties, and these include berries like cherries, then blueberries or raspberries, foods like ginger or garlic, which all are readily available in the market, and they should be consumed during such viral infections. I'll tell you why. Because during the active phase of the disease, the inflammatory response which is generated by the body is at a peak, and there are certain mediating factors which are produced by the body. Let it be in the form of cells, like the white cell count goes up, the neutrophil count goes up, then the platelet count might go down, the C reactive protein might get increased. There are multiple factors which exacerbate the inflammatory response in order to control the infection or fight against the infection. This happens in the active phase. But after the active phase has been passed, the inflammatory response may still continue, and all the inflammation starts happening in various parts of the bodies, especially the joints and the muscles. So, when it goes over there, the inflammatory response causes swelling of the joints, or it basically causes pain in the joints or stiffness in the joints, and there can be pain in the muscles or rigidity of the muscles, or little bit here and there aches in your muscular part of the body, that is especially the back or the shoulder, the hands, the calf muscles, etc. So this inflammatory response needs to be reduced, and this can be done if you consume some antioxidants which are present in these food items that I have already mentioned. So try to consume these fruits and ginger and garlic through the food that you eat, so that it will be very helpful for you to control the inflammation which is happening in the recovery phase, and it will also help boost the healing process. And number 5 is turmeric. From age old traditions, Indian rasois have always used turmeric in making various meal preparations. And turmeric has a lot of scientific and medicinal property value, because it has been researched, it has been documented that how turmeric is useful in curing a lot of diseases. So it has multiple properties. It has anti-inflammatory properties, it has antioxidant properties, it has what we can say anti-mutagenic properties, it has anti-carcinogenic properties. There are a lot of properties turmeric contains. So you can consume turmeric in the form of powder. You can put it in sabzis, like we all know, but many people don't know the importance of turmeric, why it is important to eat turmeric, and how great medicinal importance it holds. So try to consume turmeric in the food through the food items, so that it will help you recover through the disease. So these are the important food groups which I have already mentioned, that which you can include in your diet, especially if you are in the post viral phase. Along with that, I will also tell you to drink milk, because milk contains calcium, and calcium is very important for the strengthening of the joints. So try to include calcium in the diet in the form of milk and milk products. Along with that, try to walk in the morning as much as it possible, like 15 to 20 minutes walk in early morning phase is going to help you gain vitamin D. So the ultraviolet rays which are present in the early morning will help generate vitamin D in the body, and it will also help strengthening of the joints, and hence it will reduce the pain, the stiffness, and increase its strength. Also, the you can do simple physiotherapy exercises like stretching or bending. You can do slight yogas with the guidance of some yoga therapist, which can help you move your joints, move your body. And it is very helpful because many patients are telling me that by following certain physiotherapy exercises and yoga exercises, many people are feeling good. So these are the things which you can additionally do, along with inclusion of the things with along with inclusion of certain foods which I have already mentioned. And when I'm telling about the inclusions, I will also say about the exclusion part as well. In exclusion, try to avoid spicy food, try to avoid salty food, try to avoid frozen foods and high sugar contained foods. So these are the foods that you should avoid, especially you are in the recovery phase of the disease. So this is all about this video, and if you feel it is helpful and worth sending it to the ones you love and who are suffering from these post viral symptoms, then please like, share and subscribe Food Travel Talks. I'll keep coming up with new videos. Till then, keep watching, stay tuned, bye.